Hitchcock. Thank you for joining us here today for a very special health policy grand rounds with candidate for U.S. Senate, Corky Messner. I'm Susan Reeves, an administrator for Dartmouth-Hitchcock. The health policy grand rounds today are part of Dartmouth-Hitchcock Health's We Care, We Vote initiative, a nonpartisan voter education program that is designed to educate and empower our employees to participate in the electoral process by voting in the 2020 election. All candidates for federal and statewide office have been invited to participate, and recordings of all of our discussions can be found on the Dartmouth-Hitchcock We Care, We Vote website. Today, we'll hear from Mr. Messner, who is running to represent New Hampshire in the United States Senate. Prior to this run for the Senate, Mr. Messner practiced law and founded Messner Reeves LLP, a law firm with over 200 employees in 9 offices across the country. Mr. Messner is a veteran and has served on various nonprofit boards, and he resides in Wolfboro, New Hampshire. Thanks for being here today, Mr. Messner, and I'll first turn this over to you for some opening comments, and then we'll look forward to some engaging dialogue. For those employees who are viewing, please submit questions for Mr. Messner using the question and answer function on your Zoom platform at any time during the discussion. Thanks. Over to you, Mr. Messner.
Thank you so much, Sue, for having me. And I think this is an awesome service to your employees to give them access to candidates. And I just want to urge everybody to vote a week from today. Voting is so important, and I hope everyone does it, be it in person or through the absentee ballot system. I'm Corky Messner. I grew up in a blue-collar family in Altoona, Pennsylvania. I left home at 17. I went into the Army. I went to West Point. I graduated from West Point in 1979. I have 2 sons that are West Pointers now. One serving as a second lieutenant in the infantry, one who's a junior at West Point. After I served, I went to law school, became a lawyer. Out of law school, I went to work at one of those gigantic law firms, worked there for about 6 years. And then I had this crazy idea that I wanted to be an entrepreneur. So I started my own law firm. And that was really, really, really scary. But through a lot of hard work and some luck, I was able to grow that business into a national business, coast to coast. And so I'm running for the U.S. Senate to do the harder right instead of the easier wrong. I feel fortunate to be an American, that I grew up in very humble beginnings in a blue-collar family, and I was able to graduate from West Point and have a very successful business career. I'm entirely self-made, and I attribute all of that to the opportunity that America presents to pursue whatever dreams that you may have. And I want to make sure that those opportunities of liberty and economic freedom are preserved for everyone and for generations and beyond. So thank you for having me here today, and I look forward to answering all of your questions.
Great. Well, we have a few prepared questions for you, and then again, Courtney will let us know if we have anybody wanting to participate from our chat. Let's start out, not surprisingly, with COVID-19. As you know, Dartmouth-Hitchcock has been on the front line of the pandemic response in New Hampshire and for the region, and it's greatly impacted our fiscal health, our care delivery, and the communities that we serve. What steps would you take to address the needs of our communities during the pandemic?
Yeah, well, first of all, thank you for being on the front line of this pandemic. And, you've done a wonderful job, and it's been difficult, and I want to thank everybody for doing that. It's, what I think we need to do is we need to provide support on a very targeted basis to those people and businesses and communities that need that help. And I think it's very important that we do that, and we do it in an informed way. One of the concerns I have is that the pandemic has been viewed by some in Washington, D.C. as an opportunity to spend a lot of money in places that are unrelated to the pandemic. And quite frankly, we just can't afford it. Our debt, our national debt is now up to $26 trillion. But I think we need to target and find and help the people, the businesses, the hospitals, the communities, the first responders that need that help, and get that help to them as quickly as possible. It's been disappointing to me that so much of this pandemic and the pandemic response has been politicized in Washington, D.C. And we've seen it now with this latest attempts at trying to get help to people. And we know that 7 weeks ago in the U.S. Senate, there was a $500 billion package that included help for small businesses and enhanced unemployment. And the Senate couldn't get it done. All the Democrats voted no, and it's it's the politics of Washington, D.C. And my position has been, wait a minute, let's get that done as a first step and get help out to people. And that could have happened 7 weeks ago, and then we can debate about all the other issues related about the next package.
Thank you. Just as we had shortages of our protective equipment in the early part of the pandemic, we are all looking forward now to the production of a vaccine that's effective against COVID-19, but are already hearing about the fact that vaccines may be in short supply as well. What would you do to assure a robust supply of vaccines when they are available?
Yeah, one of the things that's being done now is with this Operation Warp Speed is as these vaccines are being developed, there is manufacturing of those vaccines going on simultaneously, and that therefore will shorten the time for the production of the vaccines that are approved. And then in addition, there's been a logistical effort to prepare for that, to get those vaccines distributed as quickly as possible. So I support those kinds of efforts. I think it's a situation where, the government can help pay for the manufacturing of these vaccines now with the knowledge that if a vaccine's not approved, you got to throw it all out. But that's okay to compress the time frame and to prepare logistically to distribute the vaccine to provide it to as many people as possible.
Thank you. Sticking with questions about the pandemic before we go a little bit more broadly, we've enjoyed some waivers and flexibilities that have been put in place by the Department of Health and Human Service and CMS during the public health crisis. And some of those waivers have removed barriers, regulatory barriers, and enabled our providers at Dartmouth-Hitchcock Health to provide more patient-centered care. Specifically, we've been able to enhance our telehealth service to provide care to patients in their homes. What steps would you take to assure that providers can continue to provide telehealth services?
Yeah, I would propose legislation to that supports telehealth, that supports providing healthcare services as quickly with as much high quality as possible. I think one of the lessons from this pandemic that we're going to learn is there's going to be profound impacts on how our lives will live in the future, and telehealth is one of those. And even in my business, we have evolved to working more from home, which means we need less office space, and so there'll be these paradigm shifts, and I think there's a lot to learn from this pandemic in many areas. And one of, quite frankly, one of the things that I wonder about with what's going on is, we had this pandemic in 2009, 2010, H1N1, and then we had the Ebola in 2014, and I've done some reading about, what did we learn from those pandemics, and why weren't the institutions of government better prepared for this pandemic? I met a gentleman living in southern New Hampshire not long ago, and he actually works for a company that manufactures ventilators, and he said in March his company was manufacturing 250 ventilators a month, and now they're manufacturing 10,000 ventilators a month, in part to replenish the national stockpile. So we have to have an honest assessment of what lessons we can learn to be better prepared for the next time that this happens.
Mhm. Thank you. Courtney, let me pause and ask if there's any questions for the candidate.
Thank you. So we do have a few questions for you, Mr. Messner. One of the questions from the audience is, what are your priorities for healthcare legislation?
Yeah, I think a couple things. I think there's been a lot of talk around the ACA and what's going on with the ACA, and we now know that the Supreme Court's going to hear this case on November 10th, and there's a lot of fear mongering around that, quite frankly, that, oh my gosh, there's a hearing on November 10th. What's going to happen with the ACA? One thing that I think everyone ought to be aware of, when the Supreme Court hears a case, they then go through they have hearings for these cases, and they go through a judicial decision-making process, which means, the Supreme Court will not make a decision on the ACA until next May or June. So one of the things I would propose legislatively is, in January, let's get legislation passed that makes sure no one is denied health insurance because of a pre-existing condition. Let's get it passed without regard to what happens to the ACA. Let's get legislation passed that continues the Medicaid expansion, no matter what happens with the ACA. Now, I will say this as a lawyer, I do not believe the Supreme Court is going to throw the entirety of the ACA out. That's my opinion as a lawyer, but who knows? But legislatively, we can do things in January to protect the American people if something like that happens.
Thank you so much, Mr. Messner. We have some more questions from the audience, if that's okay. Young people are leaving New Hampshire at a pretty high rate, and we also have an aging workforce here in New Hampshire. And so what would you do to attract and attain young professionals to New Hampshire?
Yeah, that's a really, really good question. And I think a couple of things. I have an economic plan that I call the USA Plan, Unleashing the Strength of America, and it's designed to bring good, high-paying jobs back to New Hampshire. In particular, bringing manufacturing jobs back from China, and you can do that with the opportunity zones. I think we should expand those, provide further incentives for business to come to New Hampshire. One of the things that I'm discovering as I'm out talking to people is we are now seeing more people move to New Hampshire, and even young people. I met a young couple just last week that moved here from New York City. And given what's happening with the pandemic, the tax policy in New York State and New York City, and now the issues we're seeing with law enforcement, people are fleeing the big cities, and they want to come to a place like New Hampshire where liberty and freedom is valued.
So I'll go back to one of our questions that we have prepared, and it relates to Medicare. And as you know, many of Dartmouth-Hitchcock's patients rely on Medicare as the source of health insurance. In their September 2020 budget outlook, the Congressional Budget Office predicts that the Medicare Hospital Insurance Trust Fund will be unable to fulfill its commitments by 2024, sooner than previously predicted. If you're elected to federal office, what will you do to ensure that Medicare is available and that all seniors will be able to access the medical care that they need?
Yeah. Well, this is an issue for me that's personal. My mother, we didn't have much. She in her older years, she had Social Security and Medicare and whatever help I provided her. And so it's so important that our seniors have access to high quality health care. So, we, in my mind's eye, Social Security and Medicare is number one priority for funding and protecting. And I kind of look at this that, Washington, D.C. Needs to get some discipline on the discretionary spending side and actually reduce discretionary spending. And it's so out of control that the swamp, so to speak, has to demonstrate some discipline to reduce spending. And I think if you focus on discretionary spending and reducing discretionary spending, that ultimately you'll be able to better protect Social Security and Medicare.
I wonder if I could ask you to expound a little bit on those things that you would consider discretionary spending.
Oh, wow. Everything from the military. I mean, the largest part of the budget that is discretionary spending is military spending. Now, I support having a very, very strong military, but in fact, several months ago, I had a discussion with General McConville. He's Chief of Staff of the Army, and I said, there must be ways to save money in the Pentagon that will not diminish readiness at all. And his answer was absolutely. And the bottom line, the Pentagon is a huge bureaucracy, and there's a lot of waste in there, a lot of money that is being spent that's just not being spent effectively and efficiently, and I mean significant amounts of money, absolutely significant amounts of money, and we need to change the mindset in Washington, D.C. To an approach that is, we need to get as much bang for every buck as possible, and get out of this sort of Washington, D.C. political, more is better no matter how effective it is. We have to have a mindset that every dollar has to be spent effectively. And I think, when you talk about discretionary spending, Pentagon's a place you have to start because it's so huge.
Thank you. Courtney, let's check in again with our audience to see if there's another question for the candidate.
Sure. Well, Mr. Messner, you referenced that New Hampshire is a wonderful place to live, and I think that we agree with you. But one of the challenges we have here is that we're a pretty rural state. And so how would you help New Hampshire as we struggle with healthcare challenges with our rural setting?
Yeah, I think a number of ways. I think I had a Zoom call with some of the executives from the North Country Health System, and we talked about exactly this thing, and it's important that we have high-speed broadband in the rural areas of New Hampshire so that the whole telehealth system can work for everybody. As someone who's been crisscrossing this state in every nook and cranny for the last 15 months, I know where every dead spot is in the state. It is it's something that I personally believe can be solved pretty easily with going to the telecommunication companies and and being very direct with them. I mean, as a business guy, I've been in boardrooms. I've been in many meetings with CEOs, and I think one of the first things I would do is your next U.S. senator is go meet with the CEOs of every one of these telecommunication companies, and I know what they're going to say to me. They're going to say, gee, it's the returns. It's too expensive for the returns. To which I will say, hey, you're making a ton of dough. Fix it and fix it immediately. And don't give me this return stuff. And I've got the experience and sophistication to have those kinds of discussions. And with that, high speed access to the internet and broadband, the telehealth will help our rural communities tremendously.
Well, and as we're finding out, it's also a way that we're delivering education these days. So a really critical part of our rural infrastructure, for sure. Let me turn to research for a minute. Dartmouth-Hitchcock is a research organization, and we're proud that we have many investigators that are the recipients of federally supported research grants, including from the National Institutes of Health, the Agency for Healthcare Research and Quality, and the Centers for Disease Control. Will you be an active champion at the federal level to ensure that there is robust federal funding available for biomedical research?
Yeah, it's one of the great strengths that we have as a country is our research and development in all areas, and it has contributed over the decades to increasing the standard of living throughout the world, and in improving healthcare services throughout the world. And to be on the cutting edge of research and development is extremely important. And we can't lose sight of that as we navigate the healthcare world. For example, we must reduce the cost of prescription drugs. There's no question about that. And there's a lot of ways to do it. But we need to be a little bit careful that we want to make sure that there's still incentive for the pharmaceutical companies to do research and development on new drugs, and for the academic world to do that research and development as well. And listen, I'm not one to defend pharmaceutical companies. I think our pharmaceuticals are way too expensive, but we got to be careful that we don't have a chilling effect on research and development in all areas.
Thank you. Courtney, back to you.
Thank you so much. We do have another question coming in. Mr. Messner, you mentioned the Supreme Court when we asked you a question about the ACA. What are your thoughts on the last night's breaking news that Amy Coney Barrett was confirmed and appointed to the Supreme Court, and the recent process of her nomination and confirmation?
Yeah. I would say, first of all, I think Amy Coney Barrett is an accomplished judge, an accomplished lawyer, brilliant, the right temperament to be a justice. I think an amazing role model for young girls and young women, and I think the process should have gone forward. I think she should have been confirmed. The politics of it, we know everyone was flip-flopping from 2016. And I don't think there's a question that if the parties were different here, that the Democrats would have done the very same thing. I do, and I'm on the record of saying that I think in 2016, Merrick Garland should have received a hearing and a vote in the United States Senate. And I think the U.S. senators should have been on record of voting up or down on Merrick Garland. The president had the constitutional power to do it. The Senate had the constitutional power to do it. And the Democrats would have done the same thing had the situation been reversed. And I think Justice Barrett now will be a very good Supreme Court justice. I think we get way too caught up in all the fear mongering around, oh my gosh, what is the court going to do? And I think court packing is a bad thing and it shouldn't be done. And I just, history tells us that many of these justices, that when they're appointed, how they vote as a Supreme Court justice is very different than what we thought at the beginning. And we have an example right now, Chief Justice Roberts. Chief Justice Roberts. He's characterized as a conservative on the court. I would just remind everybody, Chief Justice Roberts was the deciding vote and wrote the opinion to make sure that the Affordable Care Act was not overturned as being unconstitutional. So there's there's far too much fear mongering going on around Justice Barrett, and I think we'll see over time that the Supreme Court as a whole will do a wonderful job interpreting the laws of this country.
We're in our last few minutes now of our broadcast, and I'm just wondering, as we close, is there anything you had wished we would ask you this morning so we could learn about you that we didn't ask?
Well, I think the couple things. I'm a political outsider, and we know that my opponent, Jeanne Shaheen, is a career politician. I think there's a lot of commercials and other stuff going on that really misrepresents who I am, and I would hope everyone would take the time to go look at my website and learn more about me. I will represent the people of New Hampshire with vigor and passion, unlike you've ever seen. I've had a successful career, so I have nothing to gain personally from this. This is because I love this country. I love New Hampshire, and I want to fight for everyone. And I will be guided by a passage out of the West Point Cadet prayer that goes something like this: Dear Lord, help me do the harder right instead of the easier wrong. It's time for a change. It's time, to get people in Washington, D.C. who are not going to be beholden to a party, not going to be beholden to a political career, and to fight for everyone's rights and liberties and for economic freedom.
Thank you. Candidate Messner would like to thank you for spending time with us this morning, and to all of our staff at Dartmouth-Hitchcock. Health Policy Grand Rounds is a part of Dartmouth-Hitchcock Health's We Care, We Vote initiative. So make sure you vote next week. Thanks so much, everybody.
Thank you. Thank you so much.